If you receive Social Security benefits or you're planning to apply in the near future, this is one of those moments where paying attention really matters. The system is going through rapid changes, and whether you realize it or not, those changes could affect how quickly you get help, how long you wait for decisions, and even how easy it is to manage something as basic as updating your information. For millions of people, Social Security isn't just a government program in the background. It's their main source of income, their safety net, and the difference between stability and constant stress. Right now, that system is under pressure, and understanding what's happening can make a real difference in how prepared you are. Over the past year, there's been a noticeable shift in how people experience Social Security. More calls going unanswered, longer waits for decisions, crowded field offices, and new rules that can feel confusing or even intimidating. If you're retired, living with a disability, supporting children through survivor benefits, or helping an elderly parent, these problems don't exist in isolation. They show up in your daily life. They show up when you're trying to pay rent, buy groceries, or refill prescriptions. What used to feel routine now feels uncertain, and for many people, that uncertainty is the hardest part. A lot of viewers have shared stories about trying to call Social Security and getting stuck on hold for hours, or being told to use the website when they don't have reliable internet or aren't comfortable with technology. Others describe going to an office only to be told they need an appointment weeks away. These experiences aren't rare, and they're not happening because people suddenly forgot how to do their jobs. They're happening because the entire system is being asked to do more with less, and the strain is starting to show. Social Security is massive. It serves roughly 74 million people across the country. That includes retirees, people receiving disability benefits, survivors, and nearly everyone who enrolls in Medicare. Every single month, millions of payments are issued, and behind each payment is a record that has to be accurate. Names, addresses, bank details, work history, eligibility rules, and changing circumstances all have to be tracked and updated. For decades, this system ran quietly in the background. Most people didn't think about it unless they needed to apply or make a change. But when something this large starts to falter, the effects ripple quickly and widely. A major reason things feel different now is the scale and speed of changes within the agency itself. Since early 2025, the Social Security Administration has gone through rapid restructuring. The stated goals behind these changes were efficiency, modernization, and fraud prevention. On the surface, those goals sound reasonable. Most people agree that government systems should be modern, secure, and efficient. No one wants fraud draining resources that should go to people who genuinely need support. The issue hasn't been the goals themselves, but how aggressively and quickly they were pursued. In a relatively short period of time, nearly 7,000 Social Security employees left the agency. That represents about 12% of the workforce. Some were laid off, others accepted buyouts, and many took early retirement. What's important to understand is that a large number of these workers weren't new hires or entry-level staff. They were experienced employees with decades of institutional knowledge. They knew the rules inside and out, understood the exceptions, and could navigate complex or unusual cases that don't fit neatly into automated systems. When they left, that experience left with them. At the same time, demand didn't slow down. In fact, it increased. Baby boomers continue to retire in large numbers, disability claims remain complex and time-consuming, and Medicare enrollment adds another layer of administrative work. So the agency found itself with fewer workers handling more cases. That imbalance is where the backlog began to grow rapidly. Internal reports showed millions of pending cases in processing centers and millions more unfinished transactions sitting in field offices. These numbers aren't abstract statistics. Each one represents a person waiting for an answer, a payment, or a correction. One of the most visible signs of this strain has been phone wait times. Earlier in the year, the average wait time reached around 2.5 hours. For many callers, that meant putting the phone on speaker, going about their day, and still not getting through. In response, management shifted workers from other departments to handle phones. On paper, this helped reduce average wait times, but in practice, it created new problems. Many of these reassigned workers didn't receive sufficient training, and while they were answering calls, they weren't processing claims or updating records. So while calls were answered more quickly, the underlying work continued to pile up. This kind of trade-off is difficult to manage, and it highlights a core issue. Social Security work isn't interchangeable. Processing a disability claim, Handling an appeal or correcting an earnings record requires specialized knowledge. You can't simply move people around without consequences. When experienced staff leave and remaining workers are stretched thin, errors become more likely and delays become inevitable. Once a backlog forms, it doesn't disappear on its own. It takes time, resources, and stability to unwind it. Another major change that caught many people off guard involved fraud prevention measures. Again, the intention behind these changes is understandable. Fraud does happen, and protecting benefits is important. But the way these rules were implemented has made certain routine tasks more difficult for some of the most vulnerable beneficiaries. Actions like changing direct deposit information can no longer be done over the phone in many cases. Instead, people are required to use online systems or appear in person with stricter identity verification. For someone who is comfortable using a computer, has reliable internet, and lives close to a field office, this may feel like a minor inconvenience. For others, it's a significant barrier. Many seniors don't use computers regularly. Some people with disabilities have limited mobility. Rural residents may live hours away from the nearest office. These requirements don't affect everyone equally, and that uneven impact has been a source of frustration for both beneficiaries and employees. There are countless stories that illustrate this problem. One involves an elderly man who suffered a severe stroke and could no longer drive. When he needed to update his bank information, he was told it couldn't be done over the phone. He couldn't go online, and he couldn't get to an office. The employee who spoke with him wanted to help, but was bound by the new rules. Situations like this are heartbreaking because they reveal a gap between policy and reality. The rules may be designed to prevent fraud, but they can also leave people feeling helpless. Field offices have become increasingly crowded as more people are directed to handle issues in person. Appointments are often booked weeks in advance, and walk-ins may be told to return later. Some people arrive after struggling with the website, only to discover they still can't resolve their issue that day. For someone facing a deadline related to healthcare, housing, or income, being told to wait again can feel devastating. When Social Security is your primary source of income, delays aren't just inconvenient. They're financially and emotionally stressful. This is especially true for seniors. Roughly 40% of older Americans rely on Social Security for at least 90% of their income. When payments are delayed or changes can't be made quickly, the consequences are immediate. Rent, utilities, food, and medication all depend on that monthly deposit. The margin for error is small, and the system doesn't always account for that urgency. People receiving SSDI or SSI face similar challenges. Disability claims are already complex, requiring medical documentation, evaluations, and often appeals. With staffing shortages and growing backlogs, these claims are taking even longer to process. Some applicants wait months just for an initial decision, and appeals can stretch much longer. For people unable to work due to health conditions, these delays can push them into deeper financial hardship. Geography also plays a role. In rural areas, field offices may be far apart, and public transportation options are limited. In-person requirements that seem manageable in urban areas can be nearly impossible elsewhere. Some people rely on friends or neighbors for rides, while others simply give up. This creates a system where access depends heavily on where you live and how connected you are, rather than on need alone. Families feel the impact as well. Single parents receiving survivor benefits for their children, caregivers managing benefits for aging parents, and veterans balancing Social Security with VA benefits all experience added stress when the system slows down. Time spent on hold or traveling to appointments is time taken away from work, caregiving, or rest. For households already stretched thin, these extra burdens add up quickly. Leadership instability within the agency has compounded these problems. Over a 6-month period, Social Security cycled through multiple acting commissioners. Policies were introduced, adjusted, reversed, and then adjusted again. Regional offices were eliminated rapidly, and employees were reassigned multiple times. One former leader openly acknowledged that changes were implemented knowing there would be negative consequences, describing the agency as being subject to shifting political priorities. That kind of instability makes it difficult for any organization to function smoothly, especially one as complex as Social Security. Eventually, a permanent commissioner was confirmed, and steps were taken to address the backlog. Overtime was authorized, emergency measures were implemented, and the agency reported progress in reducing pending cases. By some estimates, about 1 million cases were processed, and disability backlogs improved in certain regions. This progress is real and deserves recognition. At the same time, independent audits raise concerns about how improvements were measured. Some calls counted as having zero wait time involved callbacks that took an hour or more, meaning the experience didn't always match the statistics. Despite everything, it's important to note that the system hasn't collapsed. Benefits are still being paid, monthly deposits are still going out. The core function continues, even under strain. Many employees within Social Security care deeply about their work and about helping the people they serve. They're operating in a system that's stretched thin, and while that doesn't erase the frustration beneficiaries feel, it helps explain why interactions can feel rushed or incomplete. There is also potential upside if modernization and fraud prevention are implemented thoughtfully. Updated systems could eventually make processes faster and more secure. The question is whether the execution will adapt to the realities people face, or whether barriers will continue to rise for those least able to navigate them. That balance will determine whether trust in the system can be restored. In the meantime, there are practical steps you can take to protect yourself. If you're approaching retirement or helping someone apply for benefits, start earlier than you might have in the past. Instead of applying 3 months in advance, consider 6 months to allow for delays. Keep detailed records of everything. Save confirmation numbers, make copies of documents, and write down the names and dates of any conversations you have. This documentation can be invaluable if something goes wrong. Creating an online account can also provide more flexibility. Even if you prefer in-person assistance, having access to your information online gives you another way to track changes and submit requests. If something doesn't feel right, don't assume it will resolve itself quickly. Follow up, call again, and send written inquiries if necessary. Persistence, as frustrating as it is, can make a difference right now. If you hit a wall, reaching out to a local congressional office can help. These offices have staff dedicated to assisting constituents with federal agencies, including Social Security. Legal aid organizations and advocacy groups can also provide guidance, especially in complex cases. Staying informed is crucial because policies and procedures continue to evolve. Stepping back, the broader picture is complicated. Efforts to improve efficiency and security are important, but the human cost of rapid change is real. Critics argue that staffing cuts and increased reliance on online systems make Social Security less accessible, particularly for seniors and people with disabilities. They worry this could pave the way for further reductions in the program. Supporters argue that modernization is overdue and that short-term disruption is necessary to ensure long-term sustainability. Both perspectives exist, and the outcome will depend on how changes are adjusted moving forward. Public reaction has been intense because Social Security is deeply personal. It represents decades of work and contributions, and people expect the system to be there when they need it. When policies change quickly and guidance shifts, trust erodes. Rebuilding that trust will take time, transparency, and a genuine focus on accessibility. What's important to remember is that you're not alone. Millions of people are navigating these same challenges, and there are resources available. Knowledge is power. Understanding what's happening, preparing ahead of time, and knowing where to turn for help can give you a better chance of weathering these changes. This moment matters, and staying engaged now can help protect your future. If you found this discussion helpful, staying connected and informed can make a real difference. Share your experiences, learn from others, and keep an eye on updates as they unfold. Social Security affects nearly every family at some point, and paying attention today can help ensure dignity and security tomorrow.